And just to clarify, a PPE is, could you just explain what that is?
Oh yeah, it's the personal protective equipment. So you wear your gown, the the it's the isolation gown. It's made of plastic, so it makes it really hot. And then I we wear shoe coverings for our shoes, and then we also wear bouffant cap for our hair, so that nothing gets in. And then you wear um goggles, and then N95 mask, which is really tight on your face. And if you cannot use the N95, they encourage you to use the popper, which is the equipment that can provide you with some air. But then we have a limited number of that in our unit, so not everyone can use it. And we also try to cover our necks so that nothing, no splashes will go in case you have patients that are coughing or vomiting or any. So it's really um like your battle gear. You're totally covered, and it's also for your, obviously it's for your protection. Yeah.
Yeah, that's a lot of gear, having to
And
wear it all day and then
yeah,
taking it off. It must be very tiring.
yeah, it takes a while to put it on and it takes a while to take it off. So and in your ICU, actually today that was one of our things in our meeting, is because in your ICU, when critically ill patients, we have to go in the room literally every hour. For non-COVID, we have to go every hour for a neuro exam. And in some emergency cases, when we give this clot busting agent, the TPA, and also when the doctors retrieve the clot so that there will be perfusion to the brain back, we have to do our neuro exam on that patient, make sure he's fine every 15 minutes for 2 hours, and then every 30 minutes for 2 hours. So how can you do that when you have a COVID patient? So today that was the argument, and we had to make a new policy because that is not doable when you're with a COVID patient, that you have to just donning and doffing will take you 15 to 20 minutes each time. So that's going to be a huge change in our practice. We are going to veer away from the frequent neuro check to like a Q2, Q4 instead of every hour, which is very going to be very tiring and unfair for the nurse because of the prolonged exposure. I know it's not fair
Yeah.
for the patient as well, but we have to also, I mean, we have other ways to know if the patient's doing okay based on the vital signs. And for awake and alert patients, we try to do the phone just to make sure they're okay inside the room instead of us coming in and, just asking them if they need anything.